Would love to introduce you to Dr. Sarah Gulick. So we've worked with Sarah quite a bit recently to deliver some resources and programs around this topic, and we're really excited to bring it to all of you patients today. So thank you so much, Sarah, for being here with us. So okay, so you should be good.
Okay, great. All right. Well, thank you, Talia, for that introduction. And it's an honor to be here presenting on this important topic for Gift of Life. There's a lot going on right now in the world, so mental health is more important than ever. So just a little introduction and overview of my training. So again, my name is Sarah Gulick, and I completed my degree in clinical psychology, my doctorate in June 2020. And I completed my final internship at Geisinger Hospital out in Danville, PA. And it's really at Geisinger that I learned more about acceptance and commitment therapy, which is where a lot of the information that I'll talk about during today's webinar is based on. So in particular, I was working in the cancer oncology department there at Geisinger. So I provided therapy to patients undergoing cancer treatment. So a lot of these techniques are really great and practical, and that's the goal today, to take away some practical techniques to help improve stress and mental health, and that is my goal. And currently I'm a postdoctoral fellow here in Philadelphia. I specialize in neuropsychology, so I do a little bit of therapy, cognitive rehabilitation, which focuses mainly on building cognitive domains after some type of brain injury or stroke. And I also do neuropsychological testing. So we're looking at how the brain functions after an injury or an illness. So just a little disclaimer today. So although we'll be talking about some coping strategies and techniques, this is no substitute for therapy. So if you or a loved one are experiencing depression or anxiety, I encourage you to seek treatment from a licensed mental health professional. And Gift of Life has a lot of great resources, and they can put you in the right direction. Okay. So my goals for today are to discuss first how depression and anxiety can really impact the transplant community and caregivers for a lot of different reasons. And on top of that, there's seasonal changes. It gets dark now at 4 or 5 p.m. And of course, the global pandemic. So there's a lot that we are dealing with here. And my goals for today are to, again, really learn some practical techniques and coping skills based on acceptance and commitment therapy to strengthen and support overall mental health. So I wanted to start out just with a little research on mental health in the transplant community. So there are a lot of common challenges that transplant recipients face. So there are long periods of hospitalization and ongoing treatment, being away from their family and their home and their routine, and also the difficulty keeping a positive outlook while separated from support networks and family. It's a lot of different challenges. And a lot of studies focus on specific organs, and they've really highlighted that oftentimes transplant patients feel that only another similar patient can understand the experience fully. And it makes sense. It's such a unique experience. And one researcher, I think, summed it up really nicely in the statement: the experience, the hope, and ultimately the suffering associated with living with another person's heart is something that oftentimes can only be understood by another transplant recipient. So the importance of community and talking about these emotions is highlighted. And additionally, caregivers undergo a great deal of stress during the transplant process. So research has found that caregivers in general experience financial and emotional distress, fatigue physically, emotionally, and also relationship conflict. So your role may shift from being a spouse to a caregiver, and that's challenging. And actually, transplant caregivers have a similar or even higher rate of depression and anxiety. So this is just as important for caregivers as it is transplant recipients. And lastly, resilience is found to be crucial for caregivers. And it's very important to get connected to resources. So other people who are going through a similar process and some type of support network is key. And where I come in today is, again, talking about some strategies that you can use in your day-to-day life and give them a try. So these techniques are rooted on acceptance and commitment therapy. So Dr. Russ Harris is the founder of acceptance and commitment therapy. So he has a very interesting background. He started out as a medical doctor, and actually through his training found that something was missing. He was really interested in the emotional well-being of his patients. So he did a lot of research and a lot of work and ultimately founded acceptance and commitment therapy. Um, so he has written a lot of textbooks. One of his most famous ones is Act Made Simple. Um, and the main idea here behind ACT is that we aren't focused on reducing symptoms or taking away symptoms or avoiding pain. We're actually focused on how can we create and live a meaningful life despite the pain that naturally comes with life. And we'll go into that in more detail, but some of the skills involved in ACT are mindfulness. So bringing awareness to the here and now and finding ways to stay connected with what's going on in the present moment versus being distracted or anxious about the future or dwelling on the past. And again, the key is to stop fighting up against the pain, but to actually embrace it for what it is and recognize that pain is actually healthy and normal. So I have a short, brief introductory video that really does a nice job of summarizing the key concepts of ACT. And this is very much simplified, but I do think it's a nice starting point. So I will pull that up here. Let's see. Okay, here we go. And we'll get the sound too. Okay. Okay.
Think you know FanDuel? Well, what if we told you that we've got an ace up our sleeve? Introducing FanDuel Casino. Now you can play
Okay.
casino games like blackjack.
Is that there? Okay. Okay. So again, it's a very introductory video, simplified down, but it captures the essence of ACT. So accepting pain and not shying away from it, but actually making room for it in your life and making space for it. So ACT has a lot of different metaphors that are great at explaining some of these concepts. So one of the metaphors that I like to use is in keeping in mind some of those old movies where there's a bad guy who falls into a pool of quicksand, and the more he struggles, the faster he gets sucked into the quicksand. And in quicksand, struggling is actually the worst thing that you can possibly do. So the way you survive is by lying back, spreading out your arms, and floating onto the surface. And it's challenging because every instinct tells you to struggle and fight and flail your arms. But if you do this, you'll drown. And actually, that's similar to when you're stuck in a rip current. You're not supposed to fight it. You're supposed to just uh, float and relax. So this is similar to the concept and act of how we view pain. So there are 6 core principles in ACT, and I will actually be focusing on the final 2 today, but I'll just briefly mention the other 4. So the first principle involves contacting the present moment. So it's actually lucky for us as humans that we can think about the past and the future. So it's really useful. It allows us to reflect and learn from the past and also predict and plan for the future. But as we get older, we actually get better and better at doing these things, and we conjure up the past and the future more than we need to. And unfortunately, this creates problems for us. So as children, we can very easily live in the moment, but by adulthood, our mind is kind of like an out of control time machine. As a result, we're spending a lot of time in the past. We can relive old hurts, failures, rejections, and mistakes, or we can spend a lot of time in the future planning out every detail of what could go wrong. And meanwhile, we're missing out on life in the moment today. It's really hard to get satisfaction or fulfillment from life if we're not actually present to appreciate it. So that's one of the first pieces of ACT. Finding ways to reconnect with the present moment. And mindfulness is a really great way to do that. And there are a lot of really nice apps out there, and I'll go into some resources at the end of the presentation if you're interested in trying some mindfulness activities. Now, the second principle is cognitive diffusion. So that's really a fancy way of saying you actually create more awareness of your thinking. So we're working on taking a step back and just becoming more aware of our thoughts. So when our thoughts become really negative or just all consuming, we notice that. And the first step there is just becoming aware. And then from there, we can do things to change that. But really, cognitive diffusion is just noticing when your thoughts start to get out of control. And acceptance. So making room again for those tough emotions that we face. And instead of avoiding them, pushing them away, not talking about them, we actually give them space to be and stop running from that pain. And pure awareness, or the observing self. So this is a little bit technical. This is probably the most technical piece, and we won't spend too much time on this today. But the idea here is that as we go through life and our situations change, our roles change, we are still the same person that we have always been. So there's a part of us that is really unchangeable. So even though our physical situation may change through illness or just getting older, there's a piece of us that stays the same. So getting in touch with that continuity. and values. I'll spend a lot of time today talking about values because I think this is a great way to really cope with life situations and circumstances. And I just think it's one of the most important pieces of ACT, really, and committed action. So taking our values and thinking about how can we actually translate them into action day to day. So we'll spend most of our time talking about values and action. Okay, so why is acceptance important? So acceptance is not succumbing to illness or giving up by any means, but it's just giving space to those tough emotions that naturally come for anyone, but especially in a chronic medical situation. So we're not fighting the pain, but we're acknowledging this is challenging and heartbreaking at times, but we're allowing ourselves to fully experience it. And by doing so, we have permission to feel that pain, and we also free up more energy since we're not fighting against it. We can focus more on our values and how do we still make life meaningful. So I have a little exercise here, and this really taps into the idea of watching your thoughts, developing some more awareness of what we're thinking, what's going on in your mind. And the idea is not to change anything, but just to become aware and start to notice your thinking. So this exercise is called floating leaves on a stream. Close your eyes and imagine a beautiful, slow-moving stream. The water flows over rocks and around trees, descends downhill, and travels through a valley. Once in a while, a big leaf drops into the water and floats downstream. Imagine you're sitting beside that stream on a warm, sunny day, watching the leaves float by. Now become conscious of your thoughts. Each time a thought pops into your head, imagine that it's written on one of those leaves. If you think in words, put them on the leaf as words. If you think in images, put them on the leaf as images. The goal is to stay beside the stream and allow the leaves to keep floating by. Don't try to make the stream go faster or slower. Don't try to change what shows up on the leaves in any way. If the leaves disappear, if you mentally go somewhere else, or if you find that you're in the stream or on a leaf, just stop and notice that this has happened. File that knowledge away, and then once again return to the stream. Watch a thought come into your mind, place it on a leaf, and let the leaf float downstream. Continue for the next few moments, just watching your thoughts float by. So we could spend a lot of time on that, but we won't for the sake of time. But the idea there is to just see what it's like to become more aware of your thoughts and gently watch them pass by. It's really hard, and it's okay to get off track. If you start thinking about what you'll make for dinner, what you need to do tomorrow, that's normal. You can just notice that and redirect yourself. Okay, so going into values. So values are really like a compass. So they're like directions that help guide us, and they're different from goals, and it's an important distinction to make. So this is a really nice video actually created by Dr. Russ Harris himself that I always like to show. So I will pull that up.
Roulette and online slots for real.
Here we go.
Society tells us the way to be happy is to achieve our goals. Get that great job, earn that money, get a good body, find a partner, have happy, healthy kids, have a big house, have a nice car, have holidays. Goal, 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 goal. And it's true that if you do actually manage to achieve these goals, then there is a little moment of joy and happiness. But how long does it last? How long before you're looking at the next goal, and then the next goal, and then the next goal? And as we live our life trying to constantly strive to achieve these goals, one after the other, how tiring and exhausting does it get? Is this you? There is a radically different way to live your life, which is a life based on values, a values-focused life. It's like two kids in the back of a car, and it's a 3-hour car journey to Disneyland. And the first kid is totally goal-focused. Are we there yet? Are we there yet? How much longer? Are we there yet? This journey of frustration, it's all about the goal. The second kid is values focused. He's got the same goal. He wants to get to Disneyland, but he's also in touch with his values around curiosity, adventure, having fun. So he's looking out of the window, playing I Spy with My Little Eye. He's counting all the, the interesting farmhouses that he sees on the way. He's spotting interesting farm animals, cows and sheep. He's noticing different types of trucks and cars on the freeway. So he's actually appreciating the journey as he heads towards his goal. Now, they both reach Disneyland at the same time. They both have a fantastic time at Disneyland because they both got to achieve the goal. But the first kid had a journey of frustration. The second kid had a fulfilling, rewarding journey. Then on the way home, the first kid, are we home yet? Are we home yet? Are we home yet? All about the goal, all that frustration. Second kid's looking out of the window, noticing how the world looks different at night, spotting the lights in the farmhouses and the cat's eyes on the freeway. The car breaks down on the way to Disneyland. Now, both kids are really disappointed because neither of them achieved their goal. But the second kid at least had a fulfilling journey up until that point. Now, when the pickup truck arrives to tow them home, the first kid, oh, it's not fair. I want to go to Disneyland. How long before the car gets repaired? It's not fair. It's not fair. The second kid starts to notice how the world looks different when you're sitting in the front of a pickup truck high above the level of the rest of the traffic. So this is the very important distinction between the values-focused life and the goal-focused life. In the values-focused life, we have the fulfillment and satisfaction of living our values every step of the way towards our goals, the satisfaction of achieving our goals, and the fulfillment that comes of living our values even when we don't achieve our goals.
Okay. So I just love that video. I think it really depicts the difference between a values-guided life and a goal-driven life, and they're vastly different. Now I have a few questions here that you may not have time to answer right now. These are pretty thought-provoking questions. You can always come back and revisit these, but these are some great questions to keep in mind when you're going through the process of figuring out what your values are and what is the most important to you in your life. What do you want your life to stand for? And what do you want to stand for in the face of hardship? What kind of person do you want to be remembered as? And what do you want to be? Who do you want to be in your relationship with others? What kind of a friend or partner, parent do you want to be? So take some time to think about what came up for you, or do so down the road if you decide to revisit this. And it might be surprising to think about what came up for you, what came to mind initially, because we don't often take that time to sit down and think, what is the most important to me in my life? And values don't need to be justified. They're personal and they can vary from person to person. Now, this is another really great exercise that I enjoy that helps you tap into your values. So think about a hero that you admire. And this could be a fictional character, could be a family member, could be a celebrity or a politician, anyone who you admire. And take some time to think about what values does this hero possess? Why do you admire them? How are you already like that person? Are there any similarities? And maybe that's why you admire them. And how are you different from them? And are there any actions that you can take in your life to resemble that person, to resemble those values that you see in another person and appreciate? And of course, obstacles will happen. So think about any obstacles that might come up and think about resources that you can access that will help keep you motivated moving forward towards living true to those values. Whether that's social support, friends, or therapy, whatever it is, thinking about what is realistic to help keep you motivated towards living true to those values. Now, I actually have an example that I always keep in mind here when I think about values and flexibility. So I actually had a patient who was diagnosed with cancer right when COVID hit last year. And for her, one of her values was being a great friend. She was very social. She was involved in a lot in the community. And with COVID, that was all taken away. She could not physically go to these things that she used to go to. So she really had to reflect on how important that value was to her. For her, friendship and her social circle was a major value, a big priority for her. So she was able to adapt and use Facebook and make phone calls every single day to touch base with people that she cared about. And that really helped her in her journey through cancer to still feel like she's connected to others, living true to that value. So I just think that is so neat to see that flexibility that she showed there. So committed action, really this is where it all comes together. How can we use our values to guide our daily lives? So you might need to be creative, and this can take some time, some brainstorming. It's important to start small. We don't want to set ourselves up for failure. And it really is a process. So some of these values might need to be reevaluated from time to time if we get off track. If something becomes too unrealistic or overwhelming, we can always go back and reevaluate. And this is also an important key here. So some values can actually seem like they're competing against each other. So for example, love for others and also self-care. I think that's a pretty common one. So you obviously value your relationships, your family, but you also need to take care of yourself. And that can be difficult to work through. And I think there's a lot behind that, but it is just as important to take care of yourself because you can't pour from an empty cup. And as I mentioned, barriers, they will happen. So if we keep that in mind, we'll be less disappointed when they do come up. But in ACT, they're big on acronyms. So one of the acronyms for barriers is DARE. So how do we address barriers? We can create some distance between unhealthy thinking. So that's where that activity comes into play, that increasing awareness of our thoughts. What are we telling ourselves? How do we talk to ourselves? And if we find that we're being very negative about our goal or our future, our outlook, how do we kind of create some space there, pull away from that a bit? And acceptance, accepting the discomfort that will come from new situations and setting realistic goals, and again, embracing values. And I'm sure this is not new, but goals should be SMART, so specific, meaningful, and flexible, adaptive, realistic, and time framed. So an immediate goal would be something that you could do within the next 24 hours to live true to your values. So something small and easy, that could be something like calling a relative that you haven't spoken to in a long time. Or it could be leaving a note for a neighbor on their door to let them know you're thinking about them. And in the short term, that's more the next few weeks, so that could take a little more planning. And medium term, next few weeks to few months, and long term, things that could be over the next few years or so. And again, small steps are really important because we want to set ourselves up to feel fulfilled day to day and feel like we are living true to our values, even just day to day. It doesn't need to be a large monumental task. And again, check in with yourself from time to time. And we can always get distracted, and keep in mind, what values guided actions have I been taking lately? What's getting in the way? Am I feeling fulfilled or am I feeling stuck? And why is that? What can I do to change that? So we are coming up on our end of time here, but I have one more activity that I think really sums this up nicely. It's called Waiting for the Wrong Train. So imagine you're on a journey and the destination is somewhere really special, a place that you've always wanted to visit, somewhere you've wanted to go for as long as you can remember. When you get to the train station, you see two trains. Both of them have signs for your destination. One train is a bit odd looking and strange. Some of the seats look hard and uncomfortable, and overall it looks kind of dirty. The train on the next platform is quite different. It looks familiar, safe, reliable. The sign says it has air conditioning, a movie theater, and fancy food. You think, wow, I just have to take this train. I couldn't possibly make my journey on that other one. There's no way. So you wait to board the wonderful train, and in the meanwhile, the odd-looking train goes on its way. You keep waiting for the safe, comfortable train to board, and in the meanwhile, another odd train leaves the station. And then another, and then another. And all the while, you're waiting for a chance to board this great, reliable train so you can take your journey. But here's the thing. What if the safe train won't ever leave the station? What if you're waiting for the wrong train? So the idea here is you know what you want and what you value. So what are you prepared to do or experience to get there? So how can we translate those values into action? And it may not be what we've always pictured for ourselves or what we would hope for in an ideal circumstance, but at the end of the day, we can still make a meaningful life with what we're given. So again, ACT does not set out to fix a problem. It's about creating a meaningful life. So there are some really great resources out there. So these are mostly meditation type apps. So they're all free. You can play around with them on your phone or iPad or tablet, but they're a great thing to explore and give them a shot. Some of them are very short too. I know it can be difficult when we're busy, but some of these are 1 to 3 minutes long. Okay. And that is all I have for today.
Thanks so much, Sarah. Dr. Gulick, that was really amazing, and I think really can hit home for a lot of transplant patients and families as far as values and committed action, because people go into transplant, with the goal of getting a second chance at life, and it could be really meaningful for them to identify what their values are, and in turn, committed action to support that. I have a question. If And if anyone has questions, please feel free in the Q&A. Or in the chat even. But so I'm just wondering if there are other like handouts or resources, especially around like how to identify what your values are,
Yes,
that we might be able to share with people.
absolutely. I can email you some great values worksheets that I've used in the past. That I actually have a few worksheets that have a bunch of different values words, and it's just a starting point because it can be kind of abstract at first. So I'll definitely share those with you.
Yeah, that would be perfect. And we can share the slides if that's okay. So
Absolutely.
following this in the next few days, we'll send out an email with this information plus some of the resources. And I'd really encourage people to try to do some of the activities. You know, especially now it's winter, seasonally, things can feel a little differently in transplant and COVID. So I think they could be really helpful.
Yeah, absolutely. And ACT is really big on worksheets, so I can send you some websites too that have just a lot of different types of ACT worksheets and activities that are pretty neat. So I'd be happy to do that.
Perfect. Also in that email, we're going to send out a survey. So we'd really like if you could fill a survey out about your experience with this. It's really helpful for us as we continually develop these webinars each month. So any questions for Dr. Gulick so far? Quite a few people said thank you. So one person did have a question slash comment, so I'll read it because I feel like this might be a shared experience. So he or she said that your teachings are wonderful, and sometimes they're burdened with the reality that they only have a short time left of life, and that combined with COVID, where I can't make the most of my time without risking my life, how do I get over the nervousness of that finite life? So like with transplant, you know, a lot of feelings might be that it's not going to last forever.
Sure. Yeah, that's a great question. That came up a lot when I was working in the cancer center. And one of the questions that I focused on a lot with patients was thinking about your legacy and kind of tapping into those values of what do you want to stand for and who do you want to be remembered as, and what could you do in the time you have left to reflect that. And for some people that was really helpful and hit home, and it could be spending more time with family members, and with COVID, that's tough. But maybe Zooms, phone calls, just making the most of the time left safely. That's a tough one.
Yeah.
Yeah.
Another person had asked, can you give an example of a values-based decision or action?
That's a great question. So I'll go back to the one patient that I saw that I always like to use her. Her value of relationships. She put that above all else. So the decision to adapt when COVID hit, and instead of just staying home with her family, she was comfortable at home with her family. And instead of just staying in that little bubble, she decided, I'm going to get familiar with technology. And she actually was not very tech savvy to begin with, but she decided, because I value my relationship so much, I am going to figure out how to use Facebook and how to use Zoom. And I'm really going to structure my days around keeping in touch with people that I care about.
Great, thank you. Another person had said it's hard to accept the fact after 11 years post double lung transplant that they're now in chronic rejection. And how do you know how to enjoy each day? Or that they are struggling to enjoy each day?
Yeah. Oh, well, my heart goes out to you. That's a tough situation. And I would say similarly, although there may not be much, it may feel like there's not much to look forward to or much time left even. Um, Taking the time to still reflect on who are you as a person and what has your life been like? What are you proud of? And how can you share that with others in your time left if that's important to you? Um, but really just spending the time to tap into what do I value the most? What are my priorities? Because even though you're in this situation, you're still you, and your time is still valuable. That's tough.
Yeah, thank you. I'm sorry as well.
Yeah.
And then the last question, how do you embrace or like lean into the pain? Because a normal concept is if you have pain, like you want to avoid it, physical
Mhm.
pain.
Yeah.
So how would you
Yeah.
suggest?
Great question. It really is a kind of a radical idea, this not running away from the pain, but leaning into it. So we start by creating that awareness of first of our thoughts of what our mind is telling us, but also how we're feeling. So a big part of ACT also is just being able to identify how we feel day to day. And it sounds simple, but it's actually pretty hard, because we're so often in autopilot, just get it done, get through the day. But a big part of ACT is recognizing how you're feeling. And that could be, recognizing when you're feeling a little bit down. And another part of ACT that I'll also send out is there's a lot of different feelings and emotions that we don't usually think of off the top of our head. So ACT kind of helps you identify specifically, no, what am I feeling today? And it encourages you to reflect on some of the more painful things that you're going through. And of course, you want to have support there too. So this is great to work on with a therapist or even a spouse or a loved one, because you don't really want to go through it alone. But that's one way to open up to the pain, just to recognize, okay, maybe every day I'm not feeling that great. Um, and that in and of itself is a step towards opening up to that pain. Um, and then of course the concept of not trying to fix it. So not necessarily realizing I am so depressed, I need to fix this. It's more of an attitude of I'm feeling down, and why is that? And it is what it is. But I can use that knowledge moving forward, but there's not as much of a focus on I need to just get rid of this depression and push it aside. It's kind of like almost becoming friends with it, which sounds strange.
Yeah, it's interesting. When I was in grad school, I remember thinking like, well, you become a therapist because you want to take that away from people. Like someone comes to you
Mhm.
because they're feeling depressed. So your role is to like remove that. And
Right.
I quickly learned it's not about removing it, it's helping them to sort of manage it and
Mhm.
cope, and the idea of like normalizing those feelings. Like
Mhm.
the feelings of anxiety or depression or whatever, like those feelings can be normal, and you don't necessarily have to like hide it away in a box.
Mhm.
um,
Exactly.
yeah.
Yeah.
um, I do want to mention too, and Dr. will mention this in the beginning as well. If you're feeling, it sounds like, I mean, we know transplant can be very difficult and there's a lot of ups and downs. If you're feeling like there's more downs for you, and the day to day is more difficult to manage emotionally, and you're just feeling like what you're doing is not really helping, we can support you in identifying someone that you can talk to, a professional. We can look into identifying therapists who might specialize in like chronic illnesses or transplant. But we can also help to identify therapy who specializes in like this type of therapy, like ACT or CBT, even depending on what you're going through. So I think Dr. Gulick did a really wonderful job of really explaining and sharing the values of ACT and how you can incorporate it. But sometimes we just need like an extra boost and an extra support person. So, you know, we want to be here to support you through that if that is the case. So please feel free, when I send out the email with the resources, if you are looking for something more, please feel free to respond to me, and you know, I can coordinate with her as well, and we can see like what kind of additional support networks are out there for you. So thank you so much again to Dr. Sarah Gulick. I've known her for a while now, so I apologize. I keep calling her Sarah. Dr. Gulick. So thank you so much for spending this time with us. This was really a great start to our webinar series this year. I hope everyone stays connected. Please continue to participate in our monthly webinars. We have a lot of exciting ones coming up, and you should see emails coming soon with that info. Additionally, again, we have lots of virtual support groups right now. So if you do want to reach out to other transplant families or patients through our support groups, and you haven't gotten those emails, let me know and we'll get them to you. So thanks again for everyone for attending, and hopefully we will see you next month.
Thank you, everyone.